curious, when genomic testing first began to be a thing, we'll say 12-ish years ago, give or take, there was a lot of assumption that people's mutations change rapidly. And so if I got a test today, but I wasn't really looking for a new treatment option for another 6 months or a year, that would be like way out of date and pointless. We now know that that isn't the way it goes. While there are some variations, what's your knowledge of how your own individual genetics that are influencing your cancer might change over the course of the years that you have the disease?
So we do know that it does change, but probably about 80 or 85% of the alterations remain stable. And probably about 15% will evolve with time. And they can also, by evolving with time, they can also cause resistance. So one thing that I do, for instance, for my patients is I will sometimes rebiopsy a growing lesion, or I will get a liquid biopsy. I will get a blood test to see if there's new mutations which have occurred. But this is also another reason to try to do a combination of drugs that is best suited to the tumor right at the beginning, to hit the tumor hard right at the beginning. And again, these drugs, especially these target new drugs, they can hit the tumor hard without hitting the normal tissue. And
Yes.
that's really what we want to do, because the harder that we can hit the tumor right at the beginning, the less chance the tumor has to evolve resistance. But if the tumor does evolve resistance, again, in my own practice, I'll rebiopsy the patient, or I'll do a blood NGS test as a follow-up, and then we can rerun the reports that incorporate any new data that has emerged from that, so that we can improve on the regimen.